just give me one moment. I'll be with you just a second. Okay. Just settling up some previous patients' documents. So I believe this is the first time that we're meeting face to face. Yeah? Can I just get your name just quickly just to confirm that I do have the right person with me? Well, I've had a few instances where I've done some examinations on people that got the wrong room, so I like to try to avoid that. Wonderful. I'm just going to pop some of your details into my typewriter. Old-fashioned, I know, but I do find that the older techniques are a lot more effective. Okay, so your name? And last name? Wonderful. Okay, that's fine with me. I mean, I don't really need that much more information. So, my name is Dr Charlatan. I'll be looking after you today. What we're going to be doing is just going through a few physical exams and just identifying some of the concerns that we have, and pinpointing some of the reasons that you may be having some symptoms that you've experienced. It's a very broad exam. Okay, so nothing too specific. We can always have more appointments after if you are happy with this one. I do usually only see my patients once. Okay, so we'll go through some physical exams first, and we'll just see if we need to do any further exams after we've done the main ones. It's fine. Okay, first off, I have this here. It is a chapstick or a lip seal. What I'm going to need you to do is just look at that, do that for a minute. Okay. Perfect. So while I'm doing that, just look at this centre of my forehead for me, okay? Okay. Oh, don't worry about that. There's just a bit of lipstick, I think, from an older client, but keep focusing for me. Wonderful. What does that do? It's one of the most important tests that we have, actually. That seemed to be okay. Just gonna, every time we do a test, you're gonna see me go to my little notebook. Okay. I'm just gonna write down some of the results, okay? So don't be alarmed or anything. Okay, so the second test, I have this light here, and you probably had something very similar to this before, I'm guessing. So I'm just going to shine the light into your mouth. Okay, so open wide, pretend that you've been given just the biggest like carrot or something. Yeah, like, you know, those big carrots you get. Just pretend you're eating one of them. So just open up lovely and wide for me. I'm just gonna right in there. Okay. And if you just push your head up slightly, perfect. Just because I really want to see it right down there, you know. Because that's where all the information is. Okay. And if you put your head down, I'm just going to see sort of like the back of your teeth area kind of here. Because when you're staring down that kind of part of your teeth, we can really get a good sense of like information. Good amount of information. Perfect. I'm gonna just do it one more time. We just need to see the response of the tongue. Okay. Wonderful. There's a lot of information that your mouth carries that we don't really know about. Obviously, all your words come out of your mouth. Yeah, and probably some of those words are like left behind, and we can get a good idea of what's going on in your noggin. Okay, like I said, I'm just going to write that down again. Alright. Okay, for the next test, I've just got a little bit of water here. Wonderful. Yeah. I think that was a good one. We don't need to write that test down. I know that this is a little bit fast-paced, okay? If at any point you feel uncomfortable, or you want me to stop, or you want me to slow down a little bit, just send me an email, and then I'll get back to you as soon as possible. I'm actually on annual leave at the minute, so there might be a bit of a delay. Okay, honey, right. Okay, so I have this stethoscope here. Okay, and we're just going to listen to what energy we can pluck from you. Okay, so I'm gonna pop that there. And for this one, I just really need you to keep still. It's a very precise exam, and I need to work quite efficiently. All right. Okay. Just stay still for me. That's wonderful. Again, stay very still. it's working. It's pretty hard. Now are you feeling? That one can be a bit of an intense one. After that one, a lot of my patients do feel a little bit dizzy, maybe a little bit dehydrated, some things along that line. So I like to offer a can of lentil and bacon soup. The reason is it's very, well, it's just a very good soup, isn't it? And I'm sure it will do something for you. I do get a slight commission. I'm joking, I don't. No. One day, maybe. Fingers crossed. We can carry on. Yep, fine, sorry. Right, let me just pop that into my records. I have a couple more things that I need to do for you, just so I can get an idea of what sort of sounds are coming from inside you. Okay. I have some of these. They're very sterile, clear clips, and they're just going to hold back some frequencies for me while I check the internal frequencies. Then I can place an equalizer in, and we can get a good idea of what sort of frequencies are most harmonious to your skin, liver, all those sorts of things. Okay. These are sterile. Okay. So don't mind me, I'm just going to undo those. Again, if you need me to slow down, if you need me to email, that's it. You're a quick learner. Very good. Alright. Just relax for me, just stay very still. That's it. Perfect. Alright. Okay, I'm just going to get just a little bit closer to you. I hope that's okay. What we're going to be doing is we're just going to pop these clips on you. Wonderful. How's that? Is that okay? We'll just pop that there. Wonderful. That was the first one. Alright. That's it. Oh, that one didn't adhere. Perfect. so I'm now going to have a little look inside at your frequency. So most of my patients will say that this sounds a bit like static, you know, a bit as if your body was made out of sparkling water, or like radiation sickness or something. So just, I'm going to use this device here. For this, you need to stay very, very still for me, okay? Wonderful. Okay. Speak. You gotta stay really quiet for this one. Thank you. I really appreciate it. I can't afford to have this one go wrong as well, you know. Okay. It's interesting. I can only really pick up reggae. And actually like one song from the 90s or something, but which is quite interesting. Okay, I'm going to go on the other side now. Okay, like I said, you need to stay very still for me, okay? Thank you. It's very interesting on the other side of you. I can hear a bustling cityscape in the 1920s, which is like a stark contrast to the other side, you know. But we are all natural. This is the sort of thing that our bodies create, you know. Okay. Now while I'm in here, did you want me to tune anything for you? Just want me to leave you alone? Well, I can do after the procedure's done, okay? I won't meddle in there. Okay. I think I've got all the information I need from that. Just give me 1 second. Don't mind me. Oh, wonderful. Alright, I think there's just one last thing that we need to do. It's less of a test, it's more of a treatment, just so that you can leave today a little bit more relaxed, feeling a little safer in the knowledge that we've got everything we need. I'm going to bring in my colleague. His name is Benjamin. He is just as trained as I am in whatever this is, and he's going to really allow us to just make sure that every bit of information we need is all neatly packaged up inside of his head, and then we can then create a treatment plan with the information that we have. Okay, Benjamin, would you like to come in? All right, Benjamin. Okay. Hi, Benjamin. As you can see, we've got our patient in front of us. And our patient has been suffering from a variety of symptoms. We just need to carry out one last little bit of treatment with you, just to make sure that they can leave feeling... Yeah, exactly. Okay. Alright. Just for this part, I just need you to stay very, very still, okay? I'm going to take the clips off your body. I'm going to give them to Benjamin. And Benjamin's going to be able to give us some words that we can then put into the areas that are left quite exposed from those clips, okay? Okay, just bear with me a second. I think he's still got some thoughts left over from the last patient. It's fine, they won't need them. Okay, just stay with me for a moment. I need you to stay very still, okay? Okay, wonderful. Okay, phew. That was good. Okay. Successful. High five. Benjamin's now just going to have a little bit of some time around the wound area and allow us just to see what needs to be done, okay, and what words we need to bring into the forefront, you know. Okay. Are you sure they're the right words? Just one moment, sorry. So he carried me away in the spirit into the wilderness, and I saw a woman sit upon a scarlet-coloured beast, full of names of blasphemy, having 7 heads and 10 horns, and upon her forehead was a name written, Mystery, Babylon the Great, the mother of harlots and abominations of the earth. think when you came in, you seemed quite apathetic in a way. You seem a lot more animated now, which is great, you know. Please remember to leave us a 5-star review on Trustpilot. But thank you so much, and I'm sure Benjamin says thank you as well. You have my email, okay? And if you have any questions, this is very important. If you have any signs of infection, I would just go straight to the hospital, you know. Yeah, that's my advice as a professional. Well, thank you so much, and I hope to see you soon. Thank you.